Hey there, my friend. It's wonderful to see you again. Let me ask you something personal. Do you ever feel like you're carrying the weight of the world on your shoulders, a kind of fatigue that sleep just can't seem to fix? Or maybe it's that nagging fear of losing your sharpness, of your independence slipping away. Well, what if I told you that a hidden danger, lurking in something as common as your medicine cabinet, could be making things worse? Today, we're going to uncover a secret that could profoundly impact your journey toward healthy aging. And I promise you it's a conversation worth having. I'm so glad you're here with me. If you find this chat helpful, could you do me a small favor? A simple click on the like button and a subscription to the channel helps us reach more people just like you. And I'd absolutely love to hear where you're watching from today. Drop your city in the comments and I might give you a shout out in our next video. Our goal here is to build a community dedicated to well-being, one that thrives on shared knowledge and mutual support, ensuring our golden years are truly golden and filled with happiness. Now, let's get right to it. My dear friend, Dr. Henry, a passionate advocate for longevity, recently shared something with me that sent a shiver down my spine. He spoke of a silent epidemic affecting our seniors, a problem often disguised as a solution. We're talking about strokes, or what doctors call a cerebrovascular accident. It's a terrifying word, but understanding it is the first step toward protecting that incredible active mind of yours. We need to face this head-on to protect our precious quality of life and the independence we cherish so much. Imagine your brain is a bustling, vibrant city. Your neurons are all the homes and businesses, and your arteries are the highways, delivering essential supplies like oxygen and nutrients. A stroke happens when traffic on one of these critical highways comes to a dead stop. It could be an ischemic stroke, which is like a massive traffic jam caused by a clot blocking the road, or it could be a hemorrhagic stroke, where one of those highways actually breaks, causing a flood that damages everything around it. Both scenarios are catastrophic for our health. As we journey through life, our bodies, particularly our brains, become more sensitive. Think of your brain as a classic, powerful computer filled with a lifetime of wisdom and memories. Its hardware, however, is more delicate than it used to be. It doesn't process certain chemicals the way it did decades ago. Some of the medications we'll discuss today act like a virus that overloads the system, short-circuiting the wires of that invaluable computer. The worst part? It happens in complete silence until it's heartbreakingly too late. This is about ensuring our healthy aging is a process of growth, not decline. So let's metaphorically open that medicine cabinet together. Let's turn on a bright light and look closely at the bottles inside. Not with fear, but with newfound wisdom. We're going on a mission to identify 4 potential troublemakers, 4 common medications that, while prescribed with the best of intentions, could be secretly undermining your pursuit of longevity and well-being. Our journey starts with a group of drugs that are likely in every single home, a true innocent culprit. I'm talking about the non-steroidal anti-inflammatory drugs, or NSAIDs as they're commonly known. Names like ibuprofen, naproxen, and diclofenac probably ring a bell, don't they? They're the quick fix for a headache, the go-to for that nagging back pain, or the daily relief for morning arthritis. We buy them without a prescription and often take them as casually as if they were candy, completely convinced of their safety. And right there, my friend, in that false sense of security, lies the danger to our health. For a young person with a strong heart, an occasional ibuprofen isn't a major issue. But for one of our cherished seniors, especially someone over 60 who relies on them daily for something like osteoarthritis, the story changes dramatically. These pills stop being a helpful ally and slowly morph into a saboteur, working against the very foundation of healthy aging. It's a subtle shift, one that often goes unnoticed until a crisis strikes, impacting one's ability to enjoy life with vigor and happiness. So how can something so common be so perilous? It's not just one thing. It's a perfect storm of 3 different mechanisms working together against your body. The first, and perhaps most significant, is the increase in your blood pressure. Think of your arteries as a garden hose. These NSAIDs can cause your body to retain extra sodium and water, which increases the total volume of blood. At the same time, they can make the hose, your arteries, stiffer and less flexible. This is a direct threat to your well-being. The result of this process is quite simple, yet profoundly dangerous. You have more liquid being forced through a narrower, harder tube. What happens? The pressure skyrockets, and as we all know, hypertension is the #1 risk factor for a stroke. It's like putting a constant, intense strain on the pipes in your home day after day. Sooner or later, you're risking a burst. This silent pressure buildup is a hidden enemy to our longevity and quality of life. The second mechanism is a bit more subtle, affecting your kidneys and platelets. Your kidneys are the master filters of your body, working tirelessly to keep things clean. NSAIDs, particularly with chronic use, can damage these delicate filters, especially in kidneys that have already seen a few decades of service. When your kidneys aren't working well, it just makes the high blood pressure even worse. This internal stress can make daily exercise and healthy habits feel much more challenging. But that's not all they do. These medications also interfere with your platelets, the tiny cells responsible for forming clots to stop you from bleeding. By disrupting their delicate balance, they can, ironically, cause clots to form where they absolutely shouldn't, like inside the crucial arteries leading to your brain. It's a tragic paradox where a substance meant to help ends up creating the perfect conditions for a disaster, threatening the very core of your independence. And then comes the final blow: atherosclerosis. The chronic use of NSAIDs fosters a low-grade, constant state of inflammation in the delicate lining of your arteries. This inflammation is like taking fine grit sandpaper to the smooth interior of your pipes. It creates rough, damaged areas where cholesterol can easily stick and build up, forming dangerous plaques. A small piece of this plaque can break off, travel to the brain, and cause a devastating stroke, shattering a person's quality of life in an instant. So what are we to do? Simply live with the pain? Absolutely not. True. Well-being isn't about enduring suffering, it's about smart strategy. The most important rule is this: never, ever stop taking a prescribed medication on your own without talking to your doctor. That can be just as, if not more, dangerous. The solution lies in having an honest, open conversation with Dr. Henry, armed with the right questions to safeguard your health. You can ask him directly, "Doctor, considering my age and my blood pressure, is this NSAID really the safest choice for me? What is the absolute minimum dose I need to get by, and for how long?" You can also explore alternatives. Paracetamol, known as Tylenol in some places, is often a much safer first choice for the heart. Topical gels with diclofenac or ibuprofen can target the pain locally without the systemic risk. And never underestimate the power of physiotherapy, exercise, and heat or cold therapy. The goal is to attack the root of the problem safely. If this information is opening your eyes to new possibilities for your health, a quick thumbs up on the video would mean the world and help others find this crucial advice. Now let's move on to the second group of medications. This one is particularly insidious because almost no one talks about its connection to strokes, and it addresses a very common, very personal problem that many seniors face with a sense of shame: an overactive bladder or incontinence. For millions, the fear of an accident can be paralyzing, limiting their social lives and overall happiness. It's a direct assault on one's sense of dignity and independence. The typical solution presented by the medical community is often a little pill, an anticholinergic medication. You might recognize names like oxybutynin, tolterodine, or solifenacin. They promise to give you back control, and to their credit, they often work at quieting the bladder. But what very few people explain is their direct and potentially dangerous connection to the health of your brain, which is the command center for our entire journey of healthy aging. To understand the risk, we need to talk about a chemical messenger called acetylcholine. It's a primary neurotransmitter in your nervous system, vital for muscle function, including the muscle in your bladder. But here's the crucial part. It is also absolutely essential for memory, learning, and overall cognitive function. Think of it as the lubricating oil that keeps the gears of your active mind running smoothly. Without it, our pursuit of longevity is significantly hampered. Here's where things get tricky. These anticholinergic drugs work by blocking this messenger. In the bladder, this action relaxes the muscle, and voila, the problem seems solved. But these drugs aren't a high-tech guided missile. They are more like a cluster bomb. They enter your bloodstream and travel throughout your entire body, eventually reaching your brain. For more in-depth strategies on protecting your cognitive health and overall well-being, I highly recommend our new ebook, Wellness and Aging: Valuable Tips for Seniors. You'll find the link waiting for you in the first pinned comment. Once these drugs reach the brain, they do the exact same thing they do in the bladder. They block acetylcholine. The first and most well-known effect of this is cognitive decline. Their continuous use has been strongly associated with an increased risk of dementia. Patients often complain of confusion, brain fog, poor memory, and drowsiness. They chalk it up to just getting older, never suspecting that the little pill for their bladder is slowly dimming the lights in their brain, affecting their quality of life. But the danger goes even deeper than that. The connection to stroke risk is truly sinister. You see, acetylcholine also plays a role in helping to regulate the flow of blood to the brain. By blocking it, these drugs can prevent your cerebral arteries from dilating properly when they need more oxygen. This can create zones of low blood flow, effectively setting the stage for a stroke. It's a silent threat to the very organ that defines our independence and happiness. Furthermore, side effects like dizziness when standing up or general sedation can seriously destabilize an already fragile cardiovascular system in a senior. It's like asking the air traffic controller in your brain's airport to work with half the staff and with faulty radios. A disaster becomes not a question of if, but when. It's a stark reminder that our approach to health must be holistic, considering how every part, from nutrition to medication, works together. So, if you or a loved one is taking a medication for incontinence, it's time to act. But again, don't just stop it cold turkey. First, check if your medication is on the anticholinergic list. If it is, schedule a call with Dr. Henry. The key question to ask is, "Doctor, I'm concerned about the effects of this drug on my brain. Are there more modern, safer alternatives available for me?" This proactive step is a powerful move for your long-term well-being. And the wonderful news is that yes, there are better options. A newer class of drugs called beta-3 agonists, like mirabegron, works through a completely different pathway that doesn't interfere with acetylcholine. Their risk profile is much, much better, making them a far safer choice for protecting your active mind. It's about finding solutions that enhance your quality of life without compromising your longevity. This is what true healthy aging looks like. And please never forget the power of non-pharmacological therapies. Simple pelvic floor exercises, often called Kegels, can do wonders for strengthening your control. Bladder retraining, which involves setting fixed schedules for bathroom visits, is also incredibly effective. Sometimes just making small nutrition adjustments like reducing caffeine, alcohol, or fizzy drinks can make a world of difference. You have a right to a solution that doesn't put your brain in jeopardy. Let's venture on to our third group of drugs. This category is often seen as a true lifesaver, a miracle worker. I'm talking about systemic corticosteroids, like prednisone or dexamethasone. If you've ever had a severe allergic reaction, a major asthma attack, or if you live with an autoimmune disease, you know their almost magical power. They can calm a raging, out-of-control inflammation within hours, literally giving you your life back. This is why it's so hard to see them as an enemy to our health. Because they are so incredibly effective, their potential for harm gets overlooked. But this immense power comes at a steep price, especially when they are used over the long term. Using oral corticosteroids chronically is like making a pact with the devil. They give you immediate powerful relief, but the bill that comes due for your body is sky high. And one of the most severe charges on that bill is a dramatically increased risk of stroke, a direct threat to your longevity. The problem with corticosteroids is that they don't just attack one single front. They launch a full-scale, multiple-front offensive that weakens your body's natural defenses. Dr. Henry calls it the triple threat of corticosteroids, a three-pronged attack that systematically dismantles your cardiovascular health and puts your well-being at profound risk, making the pursuit of healthy aging much more difficult. The first threat in this trio is hypertension. Much like the NSAIDs we discussed, these drugs cause your body to retain sodium while losing potassium. This leads to fluid retention, increasing the volume of blood your heart has to pump. It's a similar mechanism, but often far more potent and aggressive. Your blood pressure can shoot up to dangerous levels, putting an immense and constant strain on your arteries and compromising your quality of life. This knowledge is so vital for our community of seniors, isn't it? If you agree, I'd be so grateful if you let me know in the comments where in the world you're tuning in from today. The second threat is hyperglycemia, or high blood sugar. Corticosteroids interfere with how your body uses insulin, and they can actually provoke what's known as steroid diabetes. Suddenly your body is struggling with high sugar levels, and elevated sugar is like a poison to the inner lining of your blood vessels. It's like bathing your arteries in thick, sticky syrup day after day. This makes them rigid, fragile, and incredibly prone to inflammation and damage. This is a serious blow to our nutrition and exercise goals. This leads us to the third threat, which is a truly lethal combination of factors. These drugs can negatively alter your cholesterol levels, specifically by increasing the bad LDL cholesterol. On top of that, they can make your blood physically thicker and more prone to clotting. So now, you have the perfect scenario for a disaster. Arteries that are already damaged by high pressure and high sugar and blood that is denser and ready to form a plug at a moment's notice. It's a ticking time bomb for your health and independence. So, what's the game plan when dealing with a drug that is often indispensable? The answer isn't a simple, don't take it. The answer is to use it with extreme intelligence and caution. The conversation you have with Dr. Henry about this topic should be one of the most serious and detailed discussions you have about your health. The ultimate goal is always, without exception, to be on the lowest possible dose for the shortest possible time. True happiness in our later years comes from this kind of proactive care. You must ask, Doctor, have we truly exhausted every single alternative to reduce my dependence on these corticosteroids? For conditions like asthma or COPD, using inhaled corticosteroids is key, as they target the lungs directly with much less systemic impact. For arthritis, there are other types of disease-modifying drugs that might allow you to reduce or eliminate the need for prednisone. It's about finding a path to well-being that doesn't pave the way for a future catastrophe. If long-term use is absolutely unavoidable for your condition, then the plan must shift to aggressive damage mitigation. This means controlling your blood pressure, blood sugar and cholesterol levels much more strictly than you otherwise would. It means committing to a diet that is very low in salt and sugars, a cornerstone of good nutrition. It means making regular, gentle exercise a non-negotiable part of your routine. It's about protecting your brain at all costs. And now we arrive at our fourth and final medication. I've saved this one for last because it carries what is arguably the greatest risk, and it is at the center of one of the most dangerous and heartbreaking practices in the care of our seniors. I'm talking about antipsychotic medications. Drugs like risperidone, olanzapine, or quetiapine were created for severe psychiatric disorders like schizophrenia. In that context, they are truly life-saving. However, an alarming and widespread practice has emerged: their off-label use to treat the behavioral and psychological symptoms of dementia. Let's think about someone with advanced Alzheimer's. They might experience agitation, aggression, or deep anxiety. These behaviors are incredibly distressing for them and profoundly difficult for their caregivers to manage. Their quality of life is severely impacted. In a healthcare system that is often overloaded and short on time, the quick and easy solution is often to prescribe an antipsychotic to calm the patient down. But my dear friend, this solution is nothing short of playing chemical Russian roulette with a senior's life. It's a practice that prioritizes convenience over the fundamental well-being and safety of our most vulnerable loved ones, and it directly contradicts the principles of healthy aging. The most important regulatory agencies in the world, including the FDA in the United States, have issued their most serious warning, the black box warning, about using these drugs in elderly patients with dementia. The reason is chilling. They almost double the risk of death, primarily from stroke. In fact, the specific risk of suffering a stroke can increase by as much as 3 times. This isn't a small risk. It's a catastrophic one that threatens the very life and independence of the patient. The mechanism of harm is utterly devastating. First, they often cause something called orthostatic hypertension, which is a brutal drop in blood pressure when a person stands up. This leads to dizziness and falls, which in a senior can mean a hip fracture and the sudden end of their independence. But beyond the fall, that drop in pressure means for a moment the brain isn't getting enough blood. Repeating this day after day can trigger a massive stroke. As if that weren't enough, these drugs can wreak havoc on the heart's rhythm, generating arrhythmias that can form clots that travel directly to the brain. They also induce a brutal metabolic syndrome, causing significant weight gain, skyrocketing blood sugar, and terrible cholesterol profiles. In just a matter of months, they can induce a galloping case of diabetes, and more recent research shows they can even increase the viscosity of the blood, making it literally thicker and stickier. This is the most difficult, but also the most important, conversation a caregiver can have. If your loved one with dementia has been prescribed an antipsychotic, you must become their fierce defender. You need to question Dr. Henry with firm resolve. Ask him, "Doctor, I know about the black box warning for this drug. Have we exhausted every single non-pharmacological option? What is the plan to get my loved one off this medication as soon as humanly possible?" And this brings us to the heart of the matter, the true path to compassionate care. The first line, treatment for agitation in dementia, should never ever be a drug. It should be investigation, it should be curiosity and empathy. Why is the person agitated? Are they in pain they can't express? Do they have a hidden infection? Are they scared, lonely, or simply bored? This is where true well-being begins, by honoring the person's humanity and happiness. We've been on a tough journey today, I know. We've opened that medicine cabinet and pointed a finger at 4 culprits hiding in plain sight. The everyday NSAIDs, the incontinence drugs that dim our active mind, the miracle corticosteroids with their heavy price, and the dangerously misused antipsychotics. But the message today isn't to fill you with fear. It is to fill you with power. It is to help you take back control of your health and champion your own longevity. What is one thing you've learned today that you'll discuss with your doctor or a loved one? Please share your thoughts in the comments below. Your story enriches our entire community. If this video has served you, please don't keep it to yourself. Share it with a friend or family member who needs to hear it. And make sure you're subscribed with all notifications turned on, because in our next video, we're going to discuss a specific nutrition secret to help keep your brain sharp and your spirit bright. Until then, take wonderful care of yourself.